Hi and a warm welcome to part 2 discussion of allergic rhinitis by Smell Bell Verbal, Dr. Smell Bell Verbal, India. The clinical features of allergic rhinitis go like this. There is a lot of allergy, that is sneezing because of allergy and itching because of this particular histamine mediated, and blocking, as I already told you, it is because of the edema that is going to be formed, altered CAMP and CGMP ratio, and this CAMP is going to decrease and CGMP is going to increase. And then this rhinorrhea, a lot of secretions because of the edema, and nasal blockage is because of the edema and rhinorrhea, and it is because of the increased secretions. There is no age or sex predilection. Infants to old age it can occur. It can occur in infants till old age. Second thing is there is no sex predilection. Male is equal to female, and then the onset is more nearly at the teenagers. That is nearly some 12 to 16 years of age. So sneezing, itching, blockage and rhinorrhea. Sneezing, itching, blockage and rhinorrhea. SIBR. This is the order for the allergic rhinitis. If it is in the opposite order, it can be vasomotor rhinitis. It can be an opposite. That is rhinorrhea, blockage, itching and sneezing is the vasomotor rhinitis. Sneezing, itching, blocking and rhinorrhea is the allergic rhinitis. SIBR. SIBR is the allergic rhinitis. In seasonal allergies, there can be nearly 10 to 20 sneezes. In the early morning wake up sneezes can be there, and itching all along the respiratory tract, that is the nose, then that is the throat, and then this also in the lung region. There can be in the trachea region, there can be itching. Some people might get bronchospasm, that is spasm of the lungs, that is spasm of the lowest units of the lungs, bronchospasm, wherein it is called as unified airway disease, that is from the nose till the level of lower part of the lungs. It behaves as a single disease, unified airway disease. Allergy and asthma are interlinked to each other. Same pathology between this allergy and asthma, which I told you right now. The pathology holds same. And in perennial allergies, there is a long run. Seasonal is in particular season. Perennial allergy is a long run. There is the same thing, but blockage is more common. Perennial allergy, and the symptoms are less aggravated in the case of perennial allergies. What are the signs we want to see we should see in the allergic rhinitis? Nasal signs, there is a typical allergic salute in this particular region. They keep on rubbing like this. There is an allergic salute in this particular region. There is a dark pigmentation in this particular region, allergic salute. And you are examining inside the ear. Inside the ear, the sternate seems to be swollen and they are pale and edematous. There will be allergic mucus streaks that can be seen inside the nose, allergic mucus streaks. In the eyes, you can see the cobblestone appearance of the allergic conjunctivitis. Eyes, there is cobblestone appearance of the allergic conjunctivitis. And because of the chronic congestion and decongestion below this lower lids, there will be black colored streaks over here, black colored lining over here called Dennis Morgan folds, black colored lining over here called as allergic shiners and Dennis Morgan folds. In the ears, there can be retracted tympanic. The tympanic membrane is sucked inside because of the negative pressure. Tympanic membrane is sucked inside. In the pharynx, there can be a granular pharyngitis because of these allergies. And in the larynx, there can be edema of this particular vocal cords. Diagnosis is based on the history, and you have to go for particular investigations. History is the most important thing. Sneezing, itching, blocking, rhinorrhea. Rhinorrhea, blocking, itching, sneezing. Opposite of this or opposite? Sneezing, itching, blocking, rhinorrhea. Allergic rhinitis, blocking. So rhinorrhea, blocking, itching, and sneezing. Rhinorrhea, blocking, itching and sneezing. This is the vasomotor rhinitis typically. Investigations, you have to go for a blood count. That is where the peripherals may that you will be able to see the blood counts. Eosinophils are raised in these particular differential counts. We might need to take a smear from these nasal secretions in active phase, wherein a lot of eosinophilia is seen in a non-allergic condition called as NARES, NARES, non-allergic rhinitis with eosinophilia syndrome. There is a lot of eosinophilia that you have to note. Skin test like prick test and scratch test. Prick test and scratch test are useful for this. And RAST test, radioallergy sorbent test, IgE mediated RAST test for this condition. And nasal provocation test, you provoke the nasal mucosa with some allergen. The complications of this are like recurrent allergies leading to this eustachian tube block, leading to serous otitis media, and sinusitis can occur because of this particular thing. And nasal polypi, growths in the nose, that is nasal polypi can occur, and problems in the growth of the teeth, orthodontic problems can occur because of this particular nasal allergies. And the treatment is you have to prevent the particular condition. That is, you have to avoid the allergens, number one, avoid the dust, avoid the pets, avoid the foods which are allergens. Allergic foods are not at all advisable. and avoid cold environment also. Avoid a lot of very cool AC and avoid whatever is against you. If you feel like you are getting some symptom, you have to avoid all those things. That is up to the person. Dietary restrictions as far as required, and then medical treatment as seen, which is done by the ENT specialist. That is, drug therapy includes antihistaminics, that is most commonly the different types of generations of antihistaminics, first generation, second generation, and third generation. More commonly we use are the cetirizines, which you are commonly writing, and sympathomimetic drugs, that is adrenaline analogs, wherein to decongest them, to shrink the nasal mucosa, we are using that. That is like oxymetazoline and xylometazoline drops, and also we use the pseudoephedrine or phenylpropanol as a part of a tablets. But these have got their own side effects, so should not be used by the patients for themselves. Only under doctor's guidance they should be done. If not, there is something called as rhinitis medicamentosa, wherein there is reversal of the condition. There will be increased block in spite of using the medication like oxymetazoline. So careful while taking the drugs without prescription. Next is the corticosteroids, which are a very good anti-inflammatory effect, that is inhibiting in this particular allergic response. Corticosteroids under the guidance of the doctor. Most commonly used oral corticosteroids and nasal corticosteroids. Nasal corticosteroids can be useful. So oral ones are useful for the acute effect, and nasal ones, that is the local ones, are used for chronic effect. Oral ones inhibit the acute one, and nasal ones inhibit the chronic one by inhibit the recruitment of all these mediators. Chronic one, recruitment of all mediators by means of this fluticasone or budesonide or momentazone spray, which will be inhibiting them. These nasal corticosteroids are also useful for this rebound phenomenon, that is rhinitis medicamentosa. Sodium chromoglycate, which is a mast cell stimulator. It's a mast cell stabilizer. It stabilizes the mast cells by inhibiting the IgE release and degranulation of these mast cells. It inhibits the degranulation of mast cells. It can be used as a spray also. And lastly is the immunotherapy or hyposensitization, which is used for a long-term basis. The allergen is given in a small increasing doses until it increases the effect of IgE is suppressed. Until the effect of IgE is suppressed, it is given. It decreases the IgA and increases the IgG. Decreases the IgA and increases the IgG. It can be used for a maximum of 3 years and should be discontinued if later on. So allergic rhinitis, thus being more commonly most prevalent disease, has to be taken care properly. Most is the personal care that to be taken. Second thing is about the medical treatment under the guidance of the doctor. It cannot be taken as far as possible. Thank you very much for watching these 2 videos on allergic rhinitis, basic concepts of allergic rhinitis. If you like the videos, kindly share and subscribe. This is Dr. Smellbell Verbal from India. For more interesting understanding of stuff of ENT, kindly log on to this Dr. Smellbell Verbal cephalocervical surgical videos. Thank you very much. Have a nice day.